The medical aid team always with information to help you and possible new health benefits today to taking a daily dose of aspirin. There's a new study out that could not only help prevent heart disease, it says, but reduce your risk of liver cancer. But before you grab the bottle of aspirin, Dr. David Samadi, member of the Fox News medical aid team, vice chairman of the Department of Urology, and so much more, chief of robotics at the Mount Sinai Medical Center, one of the best technical surgeons in the nation.
Thank you.
And he didn't tell me to say that.
Thank you.
But Doc,
You're very
aspirin
kind.
is like a basic thing for a doctor of your caliber to tell us about. What did this study show?
Well, this study is very interesting. We know that aspirin a day kept the cardiologists away for a long time. A lot of this data is coming from cardiovascular data. But what they're saying now, this is from National Cancer Institute, looking at over 300,000. So it's a fairly sized study. And they followed it for about 12 years. What they're finding is that if you take aspirin a day, it's going to reduce the risk of liver disease and liver cancer by 40%. It's a great statistics. Mind you, this is an association, it's not a cause and effect. So it's an observational study. They follow them, and this is what they found.
So it's a coincidence?
So it's a coincidence.
Think it's for real? And how much aspirin?
That's right. It's a low-dose aspirin, and we cannot prove at this point, but it's a very interesting finding. Now, the history of aspirin is actually quite interesting. You and I, we have covered this in the past. A couple of years ago, we talked about the fact that aspirin a day reduces the risk of colon cancer and metastasis or death from colon cancer. There's a growing evidence of data showing that it may be helpful in breast cancer, and we know in my field of prostate cancer, it may be helpful. But of course, we need longer studies. Now, risk factor for liver cancer, hepatitis B, hepatitis C, cirrhosis, a lot of inflammation in the body.
Drinking.
Absolutely. So maybe what I take from this is that on those particular patients that are headed toward liver cancer, you should talk to your oncologist and perhaps take aspirin. But of course, there are some issues with aspirin as well.
Bleeding, for one?
Absolutely. Whenever we have a discussion like this, my fear is that people are going to run to their pharmacy and start picking these aspirins. It's not for everybody. Aspirin has side effects, causes bleeding, causes gastritis, inflammation of stomach. And so if you are taking other medications such as blood thinners, coumadines, and other things, or even airballs, combination of that can cause a lot of bleeding, GI bleeding, and end up in the emergency room. Please talk to your doctor before you take these. But I find it very interesting. And more we're finding out that aspirin may reduce inflammation, and that could be the mechanism. It could also be causing in the coagulation or bleeding cascade, maybe changes some of the enzymes and reduces the cancer from escaping. We're getting closer and closer to understanding what this wonder drug is doing for us.
It does seem like a wonder drug, not just for headaches anymore, but even the inflammation with heart disease could be very helpful. So your recommendation is maybe it's time to ask your doctor about aspirin once again.
Yes, I think if you're in the high-risk group, you should talk to them. Of course, as you mentioned, cirrhosis or liver disease can affect some of your platelets. Speak to your oncologist and have a good discussion. That's the best medicine.
Does it really matter what brand of aspirin you're taking?
That's a good point. So they've also found out that from other NSAIDs and other anti-inflammatory also helped, but that was only 26%, not 40% reduction. So there's something going on with these anti-inflammatory that reduces the cancer cell from walking out of the organ.
That's great.
So that's a good point.
And it's not the 325, it's the low dose.
That's
Thank you,
right.
Dr. Smith.